Want to study in Germany? Then Excella is the best option. Admissions with scholarships available. Call 9881 96666.
కమల్జీ నమస్తే.
నమస్తే అండి.
ఈ కాంజనైటల్ హార్ట్ డిసీజ్ని ఎలా గుర్తించగలం?
So, before I go into the diagnosis of congenital heart disease, I would like to specify this that the babies with congenital heart disease need special care. So, that care is being taken by a separate group of cardiologists who are known as pediatric cardiologists. These cardiologists are separate from those cardiologists which see adult patients, because these pediatric cardiologists are trained in treatment of congenital heart disease. So they have a separate cardiologist which is known as pediatric cardiologist first of all.
ఓకే.
So we have, for diagnosis of congenital heart disease, like a child is coming to us with the symptoms of heart disease, like he is turning blue, he's having like not feeding properly, there is some suck rest suck cycle, excessive sweating is there, he cannot play for long, suddenly he went unconscious while playing and all those things. These are the symptoms the child presents to us. So after we examine the child properly and we take the proper history and examination, after that we have some diagnostic modalities which we subject the child to. First of all, we get a ECG of those children in which we see the heart rhythm and strip. There is a ECG in which heart electrical activity is seen, in which we all are aware of this ECG. This is a very common modality. We see that. Then chest X-ray of the chest is taken, in which they will tell us about if the heart is big, how is the size, how are the lung like perfusion, how are they perfused, how is their blood supply and all. Third thing, the most important modality which we have is scanning the heart. By scanning the heart, we have a modality known as echocardiography. We have 2D echocardiography, 3D echocardiography, in which the child is taken and scanned, his heart is scanned, and it is scanned from different views, and we can tell about how the heart, there is some making deformity, structural deformity of the hearts. These are the common modalities which we use for the diagnosis. Other rare modalities sometimes which are used are like CT angiogram or MRI can also be used in some instances. But in up to 90% of the cases, the diagnosis is made with ECG, echo and chest X-ray.
ఓకే.
So if you consider like 2D echo, which I said, we normally do 2D echocardiogram.
Yeah.
So this 2D echocardiogram machine you must have seen. These are like ultrasounds. Ultrasound we all are aware of. So 2D echo is a special type of ultrasound in which we will scan the heart. In this, the patient does not need to drink lots of water, and he does not need to be nil by mouth. He can come to us anytime. Just that we want the babies to be like stable. He should not be crying for doing this scan. We will like apply a gel on the chest and we will do the scanning of the heart. In this, most of the defects, like as I said, 90% of the defects of the heart can be ruled out. Like we can see how the there are 4 chambers in the heart, as we have discussed. So how the chambers are there, how are they functioning, what are their sizes. There are 4 different valves in the heart. Are the valves functioning normally or not? Is there some leakage in the valve? Is there some obstruction in the path of the valves? How are the arteries? Like there are 2 major arteries in our body which supply the blood to our like whole body, and the second artery supplies to the lungs. How are they arranged? Are they arranged in the proper fashion in which they need to be arranged, or there is some discrepancy? So these things can be easily made out by 2D echo. So this is one of our most important modalities which we have for diagnosis of these congenital heart disease. If you talk of like 20 years back, these modalities were not available and we just had like ECG and X-rays. Okay. So it was quite difficult at that time to diagnose these congenital heart disease in such a small and precise time. So this 2D echo has made like revolutionized the things in diagnosis of congenital heart disease, and that is why a lots of congenital heart disease are now easily diagnosed even in the peripheries. In level 3 cities also they are easily diagnosed, because these echo machines are now coming at a very lower cost. They are not very costly, and we need to train people. There are trained people now which can do the scanning of these things, and this 2D echo has like revolutionized the diagnosis of congenital heart disease.
థ్యాంక్ యూ కమల్జీ.
Thank you.